Hello, everybody, and welcome to Wellness Wednesday Inspiration. My name is Fernanda Torres, and I am a nurse practitioner, and we are here to talk about low thyroid disorder, hypothyroidism. And we are having a little bit of problems connecting with the sound of Dr. Linda Marquez. So while we wait until she's able to connect, I want to invite everybody, if you know of anybody that has a hypothyroidism or low thyroid disorder, please invite them over, have them come and join the conversation. We're going to be talking about the traditional versus the functional medicine approach at treating hypothyroidism or low thyroid disorder. It's going to be very informative. Please invite anybody that you know may be interested in the topic, and hopefully Dr. Linda will be able to connect. She is the functional medicine specialist, and I will be bringing all of the information in regards to the traditional medicine and the approach at treating hypothyroidism. So please invite everybody. Again, we're waiting for Dr. Linda to connect. Unfortunately, the sound was not working, and we have been trying to troubleshoot for a little while, and I had to go live. Otherwise, they were going to cancel the program. And let's see. Before we get started, I want to give her a few more minutes. Hopefully she is able to connect. Just bear with us, hopefully. And I'll give her a few more minutes. If she is not able to connect right away, I'll get started talking about hypothyroidism, what it is, the signs and symptoms, and just giving an overview of this very extremely common thyroid disorder. So again, if you know of anybody that may be interested in the topic, please let them know. Please bring them over, have them join. It's going to be informative. And I haven't heard from Dr. Linda yet. All right, so let me get started with thyroid disorder. I'm going to give you guys an overview. Hypothyroidism or low thyroid disorder is a condition. It's a very, very common condition. It affects primarily women, and it usually starts about 40 years of age. That's when I start seeing more of it. Although guys can still have it, it's more common in females. So usually it is an autoimmune disorder. The most common type of low thyroid, it's an autoimmune disorder, but there is more reasons or more types of hypothyroidism. So Hashimoto Thyroiditis, which is an autoimmune disorder, and I was so excited, and I'm still so excited to hear Dr. Linda's take on this. I'm ready to learn about her approach because I know it's totally different than what I do for thyroid disorders. But basically, the thyroid, going just to the bare, to the basics, the thyroid is a gland, and the gland sits in the neck. And when people have low thyroid disorders, they can experience a variety of symptoms all over the body because the thyroid regulates basically things all over the body as well. So common symptoms for low thyroid disorder would be depression, would be weight gain, would be constipation, would be dry skin. So everything, what I tell my patients usually is when you have low thyroid or hypothyroidism, everything goes down. You feel kind of like just everything's dragging in a way in the body. And that's kind of how I explain it. But again, it can affect everything in your body. Your skin, your hair gets dry, your skin gets dry, and just overall not feeling well. Now, the lab results, it's an interesting thing with thyroid. The lab results are usually inverse to what it means. What I mean by that is if you go and get your blood work done, checking for thyroid, and there is a bunch of different thyroid tests that we check for. But if you go and get your blood work checked, and there is one test that is the most common, probably ordered in traditional medicine, is the TSH. And when the TSH is high, that means that the thyroid is low. So it works the opposite way. When the level is high, the thyroid is low, once again. So it's kind of common belief that if you go to get your blood work done and you have a high number, that means that you're high on whatever it is. For example, the cholesterol, right? Cholesterol is a perfect example. People say, "Oh, my cholesterol is high. I need to work on diet. I need to work on exercise," or whatever it is. Well, with this is the opposite. If it's high, that means that the thyroid is low. Okay, so common approaches for traditional medicine, for me specifically, and I'm sure some providers do it different ways, but for me, and I just received a message, let's see. Okay, so she's restarting her computer. Hopefully she can join us shortly. But the treatment on my end kind of varies. I usually don't start medication right away. If the level is borderline or is just slightly up, I usually start medication. If that's the case, I just repeat the blood work in a couple of months and make sure that it is high to confirm it. And also, if it is kind of borderline, I just kind of watch and wait with that, before I decide to start medications. This is considering that the patient may not be symptomatic. Symptomatic meaning that you're having symptoms, that you're experiencing weight gain, that you're experiencing changes in your mood, that you're experiencing any dryness in your skin, that you're experiencing a lot of constipation, etc. So if the blood work is really high, meaning your the results are not questionable in a way, then I will start medication from the get-go, from the first abnormal result. Again, granted that it's very high. And that's exactly where I want to have Dr. Linda's input and intake into how her approach differs. I know she is less in the medication, and I'm very at least for hypothyroidism, that's kind of like my one type approach for this condition. Either kind of watch and wait, or let's start the medication and control it. Now, for anybody that may be listening to it, I think she's joining. Let's see.
Hi, can you hear me,
Linda?
Can you hear me?
Yes, I can hear you.
Oh, awesome. Great.
Nice. Oh my gosh. I was thinking that you were not going to be able to join us.
I'm here. This is one of my favorite topics. I love the thyroid. But I was able to listen. So
I was kind of giving my overview. I'm glad that you were able to listen. So just kind of my approach and just a little bit of background on symptoms and what it is, and just kind of an overview. But I'm sure you have tons and tons of information for us.
Yeah, I was kind of catching like how you work with patients. I mean, I don't know, I wasn't able to hear if you were able to go over the stats with some of the numbers with, how many Americans are actually, where 20 million Americans are affected by the thyroid. Most of them are women and not men. And I think I kind of heard you go over the symptoms, everything from depression, weight loss resistance, constipation, lots of digestive issues, elevated cholesterol levels. So a lot of times somebody will go and they're tired and they're overweight and they're depressed, and they check their numbers and their cholesterol numbers are elevated, and they're like, oh, let's put you on a statin. But that's not really, the statin's not going to fix anything, Mm-hmm. So thyroid issues, there's so many symptoms when women have thyroid issues. So I think it's really overlooked, and it's one of the most mismanaged conditions out there, just because there are so many symptoms that can mimic other problems, like I'm tired. They're like, okay, well, maybe that's just stress. Yeah, maybe it is. Oh, my cholesterol level's elevated. Okay, I'm losing my hair. Okay, well, maybe you're stressed out, or you look at your nails and you see ridges, and you're tired all the time because you can't, you're sleeping 8 to 10 hours, but you're still exhausted. So those are a lot of the common symptoms. And then they go to the doctor, of course. The doctor orders the labs, and I want to kind of just go over some of the labs that that we both ordered. But traditionally, as you were mentioning, with what the hormones do, how the hypothalamus and talks to the pituitary gland, which talks to the thyroid, which is right here. It's a butterfly shaped little gland right here that impacts every single cell in the body. So we better make sure that that's working right. But go ahead. I want to kind of listen into what else you were sharing, and I'll kind of put in my 2 cents as far as I know that in traditional care, you have to follow certain protocols, the way you manage patients. And I think that's the biggest probably frustration even for yourself versus how I kind of, approach the care. So if someone comes comes to the hospital and says, I'm having these issues. I mean, how do you go about an approach? What labs do you order, and what do you look at?
So the primary labs that I ordered checking for thyroid would be the TSH, T3, and T4. And then depending on those results, I go further into doing antibody testing, which I think it's different than what you do on your end. I think you do everything at once, and I'll let you talk
do you
about
do
that.
Do you do free T3 in total, or do you?
Yes, free T3 in total.
Okay.
So, and based on the results, if it is very high, if it's very abnormal, I do start the medication replacement right away. If it's abnormal, if it's borderline, or depending on the results or how symptomatic the patient is, I will do the watch and wait. And where I was kind of, when I left off, when you came in, I was talking about if patients are on a medication already, the approach that I have is every 2 months, about every 2 months, I do repeat lab work to make sure that the thyroid is getting at a regular or at a normal level. So when you get medication and they will say, we need to recheck in X amount of time. Usually the recommended amount of time to recheck for me would be 6 to 8 weeks, no less and no more than that. Because if it is still not at goal, we need to, perhaps change the dose or readjust or change of plan, change of medication altogether, depending on how the situation may be. And if it is normal, then we just kind of keep at the same dose and monitor, depending on how stable, every 3 months, every 6 months, and so on and so forth.
So in traditional care, how is there a diet that your patients are supposed to follow, or are there any guidelines that traditional pharmacological care follows as far as when it comes to the thyroid? Because if a person, and I don't know, I do and I don't, but I want our audience to know what is the traditional care and why, as you're saying, you do recheck, which you probably do more than most doctors. They'll just prescribe, or nurse practitioners will just prescribe, and they'll check them in 6 or 12 months and just rerun labs, maybe a year later. But are there any recommendations with diet or anything?
Nothing that was given to me on training, and nothing that has been ever really discussed necessarily on training or at the workplace, I guess. I was actually looking at different articles and different UpToDate and some other places that I normally use for patient advice or, for guidelines or whatnot. And there is not much recommendations for traditional medicine in treating disorders of the thyroid. So that's pretty amazing. And I did not really find much.
Yeah. So the interesting and just kind of the physiology, as I tell people, there's a connection. However, what's really important to know that your thyroid makes the T4 and the T3, and that's what we test for. However, it makes a lot of T4, and that's what most doctors prescribe are T4 hormones. They don't rarely do they prescribe T3, but T3 is the active one. That's the one that is, I always say, it sets the metabolic rate. You do have a lot of T4. It could be up to 93% T4, and you only have a little bit of T3, but T3 is the one that gets you going. However, what's beautiful in the body is that T4 gets converted into T3, and it happens in the liver and in the gut. And so you've got to make sure that your liver and gut health are dialed in, because 60% of that inactive T4 gets converted into T3 in the liver. And of course, you have to have, like I said, a healthy liver. And then you have another percentage, like 20% is going to be converted in the gut from T4 to T3, as long as you have a healthy gut. Most people don't have a healthy liver. Most people don't have a healthy gut. So even if a practitioner gives them the T4, we're kind of expecting, oh, it's going to be converted into 3. But how do you know if you don't check the liver, and you don't ask about diet, and you don't check the gut? So that's the biggest challenge that I have seen. And you also need to, it's very dependent on iodine and tyrosine. Mm-hmm. So that's why diet is important, because, well, what if they're not getting enough iodine? What if they're not getting enough tyrosine in their diet? Your hormone production is very much dependent on that. So that's really overlooked. So if we're giving you a T4, let's say they're giving you a T4 hormone, and as long as TSH looks good, your T3 looks good, or T4, which sometimes doctors very rarely check T3, they're like, oh, you're good. But you're like, but I don't feel right. I'm still tired. They're like, okay, let's increase the dosage. And they keep increasing the dosage. And if they keep increasing the dosage every single year, that's a sign that it's not your thyroid. It's probably your gut or your liver. And I always see that most of the time it's the gut. When you fix the gut, absorption increases, so you actually see that you need less of the thyroid hormone. And as you were talking earlier too about, I check TSH, free T3, free T4, thyroid antibodies. I don't know if you check reverse T3 at all. I know a lot of traditional doctors, practitioners don't measure that. And it's very important, because if reverse T3 is high, that's blocking T3. And T3 is the gas pedal. Reverse T3 goes up when actually you're getting too much T4, believe it or not, because that can be a stressor to the body. And reverse T3 goes up when it's a stress related, but it also could be heavy metal toxicities as well. So that can be a challenge. That's why you have to check reverse T3 as well, because you just can't look at TSH, T4. You also have to make sure that you look at ferritin and iron, because your thyroid depends on that too. And if those levels are low, that thyroid conversion is not going to happen. And that's the biggest challenge, that we have to look at everything, because traditionally just a CMP is run, a lipid panel is run, TSH, maybe free T4, and that's about it. What about vitamin D? What about iron? What about TIBC? What about ferritin? Those are all important as well when it comes to the thyroid. And then digging into the gut, as we talked about, your gut health is so important for that T4 to that T3 conversion. And if your gut is not dialed in, you're not getting maximal absorption from the foods and the nutrients that you're eating. So how often do you see Hashimoto's or positive antibodies on tests that you run?
I would probably see it in about, guesstimating about 70, 80% of the time. Yeah. And most of the time it's females. Of course.
Absolutely. And a lot of it because, our hormones tend to fluctuate a lot. And the most common times that you see a lot of thyroid issues are usually, I always say it's right after a woman has a baby, when a woman's going through menopause, and when there's a major stressful event. Those are the three times that I really see a lot of thyroid issues. And because of our estrogen levels, going up and down because of the cycle, that's why women have more of a tendency of that fluctuating a lot. And as far as even by the time, even if a doctor practitioner checks thyroid antibodies and a person is not testing positive, you can't rule out Hashimoto's, because if they still have a lot of the symptoms, because a lot of the times they don't test positive till almost 10 years later, which is insane.
Wow.
And it's just and a lot of times most people will have Hashimoto's, have an autoimmune condition, and they don't even know it because it's the progression of it. So the standard of care now is really, the scope of practice, the way a lot of doctors are okay, then we'll do a scan. We'll see, and we'll look to check what the thyroid looks like. Yes, there's various ways, but we have to learn that when it comes to the thyroid, unfortunately, we're treating people based on numbers and not necessarily as a person. That's where the biggest mistake is. A person knows their body, and they say, doc, or nurse, they talk to you and they're like, I just don't feel right. But yeah, your labs are normal. It's just I know something is just not right. It's time to go do some more detective work. As I say, we're like detectives. We're health detectives, where we're going to find what is causing this problem. What is the root problem? Because that's one of the most challenging. And I love the thyroid because of in the family there are thyroid issues, and I was able to pick that up on family members when they were just teenagers and had outrageous thyroid numbers. Traditionally, doctors would have not checked that individual, and they were up in the 800s, which is ridiculous. So it's just wow. So with traditional care, that is one of the challenges. Because you're in that type of practice, what do you do to recommend so that our listeners know, how do I talk to my practitioner? You're very flexible, you're very open, but how do you talk to your practitioner? Because obviously everybody can't come see us, or some people just say, well, I want to meet with somebody in person. Well, all my appointments now are video or virtual. So I'm not seeing a whole lot of patients in person. It's just they can communicate with me via video chat. But in your neighborhood, how would they talk to you about that in regards to pursuing, if there's a possibility that, hey, I have Hashimoto's, which is an autoimmune condition, which means that my thyroid is being attacked, and that attack is being caused by the food that I'm eating.
So most of the time when patients come in with concerns for thyroid, it's usually because of their family history. Most patients that come in say, you know what, my mom got diagnosed when she was my age, so now I want to get tested because I'm concerned that I may have it. Very, very few times would a patient come in and say, I want to have my thyroid test based on the symptoms that I'm having. And this is because the thyroid can have so many symptoms like we talked about, right? So patients would come in and say, I'm having horrible constipation. I'm having such a hard time going to the bathroom. Please give me a laxative, right? So they're asking for something to relieve the symptoms, not kind of asking you to diagnose the problem. And if you don't ask anything else, then it's very easy to miss something like thyroid, right? If the only complaint is constipation, for example. I think we talked last week, or 2 weeks ago, about depression, and how when I was training, one of the things that my collaborating physician said to me was, you never want to be the provider who misses a thyroid problem because of depression. So always, always, always check thyroid. So that was ingrained in me. And ever since the beginning of my practice, that's something that I check automatically for any depression or anxiety patient, right? But going back to the symptoms, it's so easy to miss it if you're not thinking thyroid all the time. Something that I've done basically for most of my females is I just check it automatically every time there is the yearly comes in. I check thyroid, I check vitamin D, I check vitamin B12, I check all these things automatically every year because I don't want to miss it, and because many times the symptoms are not present when the condition is still kind of mild. So I check that automatically. And many times, not many times, actually, very few times, the patients would say, I don't want that. I don't want to have things tested. I just, I'd rather not. Most of the times they're, sure, if there is something that can be wrong with me, please, find out. So that's kind of my approach, is just checking automatically every year for most of my female patients, unless they refuse. And then, of course, based on symptoms, getting to the bottom of, would your symptom, would it mean that you have thyroid problems, or is it something completely different? Where I'm lacking is that communication with the gut, and what you were explaining. That's amazing. And it makes so much sense. It's so interesting.
Yeah. Yeah. With the gut, especially, gut health has also been one of I love working with women and the hormones. The gut, I'm really passionate about that as well, because as Hippocrates said, all disease begins in the gut. And we know about that brain gut connection, and even just a baby, if a baby is not, if they're colicky, it's like, okay, that's a gut issue, and it's just like, even a lot of these kids with ADD, ADHD, even autism, I guarantee any child that is autistic, I'm more than 99% sure that I will find something in their gut. We work on their gut, we fix their gut. I'm sure we're going to see some huge changes on that. So when it comes to the gut, and I know we've gone over even diet, but just kind of like, I tell people, just eat real food. Eat food that you recognize. You recognize chicken, you recognize beef, you recognize fish, you recognize broccoli, you recognize tomatoes, lettuce. Your food that you don't need to see if it has a label and recognize that, unless it's frozen. Okay, if it's frozen, sweet potatoes, just make sure that, okay, it's only sweet potatoes in there. If it's frozen green beans, it's only green beans. It's not all this other junk in there. And then the biggest thing, the biggest offender with the thyroid, believe it or not, are going to be your grains and your gluten, which is your wheat, your oats. Oats are high cross-contamination. So even though they're not really gluten, but it is wheat, oats, rye, and barley. So, and a lot of people are told, oh, just eat oatmeal for breakfast, get your cholesterol levels, it's got fiber. But there's a lot of cross-contamination with that. And there's a lot of what's called molecular mimicry, where one thing looks like another. So the body will respond in a negative way to that. And it's the same thing like with the thyroid. We need iodine. And when most breads, and a lot of people eat breads, they have bromide in there. Okay. And if we go back to like just basic chemistry in school, you remember iodide, bromide, fluoride, how they're all in that little end part of the your chart, periodic chart, right? Do you remember that from chemistry? Mm-hmm. Well, they almost all look alike. And so with the thyroid, what do we need? We need that iodine uptake. There's studies that have shown that the fluoride and the bromide they're like the competition with that iodine. And so because of that, your T4 to T3 conversion, we start to have some issues there. So one, you're looking at the foods. Two, you're looking at stress. Stress, of course, will interfere with your T4 to T3 conversion. Stress, we talked about when your cortisol levels go up. Also, when your insulin levels go up, those are interfering with that T4, T3 conversion. So it's not just looking at one thing, it's looking at the whole picture. You ask, what is your gut like? What is, digestion? Do your stools, do they float? Do they sink? Do you go every single day? Do they smell, or what color are they? We check babies that way, but we need to look at ours. The very classic, as you were talking earlier about symptoms, depression, they're losing their hair is dry, their skin is really dry, their nails are brittle, they have little ridges in their nails, they're losing the outer third of their eyebrows, their feet are cold at nighttime, it's hard, it's summer and they're still cold. They're just slow. They're like they're in brain fog all the time. So when you start to tie everything together, it's like there's more to this, doc. There's more to this, and the gut is a huge indicator. If as practitioners, healthcare providers, we were only to focus on the gut for 4 weeks, we would see so many radical changes. It'd be unbelievable. Unbelievable. Half the people in the hospital would probably not have to be there.
Go home.
Doctor visits would go way down. So, that's why it's just like, I loved the thyroid, and I get, I'm testing patients frequently, and sometimes they ask me, so, well, my doc doesn't want to check this. I'm like, okay, well then, we can order the labs. You just pay out of pocket. Mm-hmm. Is your health worth $100 for you to spend an extra $100 for you to say, to save you possible a year or 2 years of being tired, of being exhausted, of trying to figure out and not knowing what's wrong with you? Mm-hmm. It just comes back to, the do no harm to your body. So we have to take full responsibility that I'm going to eat good food to nourish my body. I'm going to think right, I'm going to move and so forth. So it just really comes back down to the responsibility of the patient, but being able to communicate with the doctor as, hey, we're a team here and I want to win. So what do we need to do to win?
Mm-hmm, mm-hmm. Let me ask you something that I'm so curious. So let's say I'm seeing a patient on my end, and the patient has hypothyroidism, and on replacement, let's say the patient is on, the most common maybe for the listeners would be levothyroxine. So the patient's taking replacements every morning, and the blood work is, let's say, around 4. And she wants a second opinion, and she goes and sees you I'm not recommending any dietary. I'm just giving the medication and rechecking the labs every 2 months, like we said before. So how do you take a patient from where I kind of leave her off and then kind of take it from the next to the next level?
Yeah, the first thing I would do, of course, is clean up their diet, as we talked about. It's just like keeping it to more Paleolithic keto template. It's more a dairy-free keto template, with I would say the 3 servings of clean proteins, whether it's fish, chicken, turkey, of course, trying to get beef, trying to get the cleanest that you can without the hormones. Okay. The deck of, I always go by, it's a size, your serving size is a deck of cards. Fish, it's checkbook. Okay. And then I would say, let's shoot for 5 to 7 cups of leafy green vegetables, and maybe add some cruciferous vegetables. And if the cruciferous vegetables bloat you, then cook them, because that already tells me that, hey, you have some digestive issues. And, have them like a couple servings of like fruit, berries are low sugar. They can have a starchy vegetable, even like squash, or they can have like sweet potatoes. I would just have them do just really basic stuff like that, and optimize their digestion with, I have my patients take hydrochloric acid and enzymes, because, we know that a lot of PPIs are prescribed, and we have a deficiency. Most of us, we don't have enough hydrochloric acid to break down the protein. And you also need hydrochloric acid for the liver and gallbladder to work properly, but for the pancreas to start secreting enzymes for proper digestion. So just by getting the gut dialed in, one, you're removing the foods that possibly are interfering with how the thyroid is working. 2, now you're giving the body good food, and you're trying to optimize digestion. It's nearly impossible to help a patient. I would have to just say, I'm going to put it out there. It's going to be impossible to help a patient optimize their thyroid without looking at and addressing their gut. It's just going to be impossible. I have not seen that in my practice, and I've been doing this for a long time. And if we don't fix the gut, we're not going to get anywhere, because we have to look at kind of as the gas tank. You're putting in the best gas in your car. The gas tank is your gut, but it's got holes in it. You're like, yeah, but I'm putting premium fuel in here. It's like, yeah, but you got some damage in that tank, the gut. We got to fix that. And that's where more extensive testing comes in. And I'm not really sure that, I mean, I know the testing that I do in my practice, I do a lot of functional medicine testing. We're practitioners. We use more of the up-to-date, cutting edge testing that is available. And I use what's called a GI map. So I've had great success. I mean, that's how I monitor myself. Also, is it pricey? Yes, it gets a little bit pricey, but I always look at it. If I have 4-ball tires in my car and I say I don't have money and that's my way to work, I'm going to find a way to get new tires on my car because I have to go to work. So I have to find a way to fix my body, because this is my vehicle. This is my house that I'm in 24/7. And this is what I'm going to be and have for the next 10, 15, 20 years.
I'm curious about something. Mentioning diet, you mentioned a lot of meat products. So what would you recommend if a patient's vegetarian or vegan?
That's really a tough one, because that's one of the things that's the hardest to deal with. When it comes to working with the gut, I'm like, okay, you can do fish, if they're not, and even like eggs can be one of the perfect foods. However, it can also be one of the worst foods for a person that has a thyroid issue. When it comes with working with vegetarians, it is hard. I'll be very honest with you. It's really hard to be healthy if you're a vegetarian. I've been a vegetarian. And I was the sickest I was in my entire life when I was a vegetarian. And I thought I was a really good vegetarian, and did the vegan and did the raw food and everything. And it was really hard in working with that. So what I would just recommend would be anything from even using like bone broth. I love the bone broth because it's very healing for the gut. Even they might have to take liver pills. It's just really, really difficult. And I would have to gauge a lot on their testing and see what their gut is and optimize digestion.
Okay. It makes sense. Now, do you see that by changing all these diet, and if the patient really tunes in with the gut and they make all these changes, they make all these changes in the diet, how common would it be for a patient to be able to get off of medication altogether?
It depends on the patient. Now, if someone has had their thyroid removed, and it's impossible to remove the entire thyroid, you're still going to have some tissue. It's still producing less T4 and T3. They're going to have to be on something. If someone's had cancers, have had their thyroid removed, half their thyroid removed, more than likely they're going to have to be on medication the rest of their life. That's just how it is. However, if there's a person that comes in and they have hypothyroid, maybe even some that have had Hashimoto's, I've seen patients completely get off their medication. Is it possible? Yes. How easy is it? It's not as easy as we think, because the driving factor and thyroid health and why it's not working properly is going to come down to stress. It's going to be the physical, chemical, or the emotional. And we haven't even got into that, but because there's even chemical stressors from environmental toxins, heavy metals, everything from women having breast implants, from the dental work that we've had done in our mouth to vaccines that we've had. to what if we're a painter and we're painting all day? What if we work with our hands and we're working with oils and we're absorbing all that? Well, that's putting stress on the liver. The liver's got to convert that T4 to T3. So it's looking at that entire picture. It's not as simple, oh, let's give them levothyroxine. It's only a T4, you know? And if they had their thyroid removed, you have to have that T4, T3 combo. Mm-hmm. You just do. And I have not seen people do well when they're just given a T4. It's very difficult. They're tired a lot of the times, especially if they haven't done the gut work, you know? So that's the biggest challenge. But thank God there's people like you and I that can direct them and guide them in the right way. Because a lot of people try to figure this out themselves. And I'm like, it's not as easy as you think, you know, and doctors aren't always going to be running the labs that you want. So it's really about working together with someone that can help you get your desired results. And like I said, because there's other areas connected that are impacting your thyroid that maybe you're not even aware of. It could be even the EMFs. There's so much out there because we have all these environmental toxins that also contribute to the chaos with our hormones.
Wow. Wow. So bottom line, for certain patients, they will have to be on medication replacement for the rest of their life. But for some other patients that have had autoimmune hypothyroidism, or your body's attacking yourself, and that's the type of thyroid that you have, based on changes in lifestyle, based on decrease in stress and eating healthier and everything, there may be an opportunity of an option for patients to get off of medications, depending on how well they're doing in other areas, gut and stress.
Yeah. With the Hashimoto's, it's difficult. I find that I've seen men they're able to get off the medication, and a lot of them can manage their hypothyroid or their Hashimoto's, which is an autoimmune condition. The way you manage an autoimmune condition is when a patients come in the office, I tell them, I'm not treating you for any symptom. My job is not to treat you for any symptoms. Symptoms are just telling me that something's not right in your body. Mm-hmm. One of your systems is not right. What system is not working? Let's go after and work on the system. When you fix the system, magically 10, 20 of your symptoms go away. Mm-hmm. Yeah. So it's about working on your systems. And when it comes to thyroid, a lot of it's going to be diet and lifestyle. It really is. Stress management is going to be huge. And one thing I do want to add, if a person does have Hashimoto's, you have to be careful. Like Armour is prescribed quite often, but Armour has cornstarch in it. Cornstarch, if you have gluten, you're almost like precipitating the thyroid attack with the medication that you're on.
Oh my gosh.
So that's where you have to find, well, maybe Thyroid works better for me. Maybe that T4, T3 combo, maybe something that's compounded works better for me. I've had patients at times that they separately take a T4 Tyrosint, and then they also take Cytomel. They'll just take T3. They take two separate ones. So it's really individualized and customized. Mm-hmm. And so it's not something that it's so easily figured out. I wish it was easy, mm-hmm. but it's not. It's really about, like I said, looking at the whole picture. So bottom line is, if you suspect you have a thyroid issue, get the proper testing done. Okay. Even if you can't get the proper testing done, clean up your diet. That's the number one thing that you can do. Optimize your digestion. I always call it the trifecta of the digestion is your hydrochloric acid, your enzymes, and even probiotics. Okay. If you have gut issues, you're going to have to get those checked out. Otherwise, you will probably have other issues. Even cardiovascular issues have been linked to the gut as well. So you've got to you have to address the gut. You just cannot go about and you just can't. Just in my opinion, that's what I've seen in my practice. And even with hormones.
No, it's mind-blowing that the gut has such an impact everywhere in the body. And yet, like you mentioned before, for traditional medicine, there is not such a push to understand the impact on the gut. So I'm so happy. I'm so glad that I'm able to, do these podcasts with you, and I'm learning, because everything that I can use for improving patients' health and overall well-being, I mean, it's amazing. And anybody that has been listening to the podcast, if you have hypothyroidism, I can't imagine the value that you just received.
Yeah. And there's something on my website. They can go on and get, I have a free ebook that kind of like in a synopsis tells you about, what are some things maybe your doctor's missing, your practitioner's missing. You can see the, what are the labs that I order, some of the ranges in there, because sometimes, if you go and the doctor's like, I know your labs are normal, yeah, but I don't feel good, so I do have in there, how do you go about that? And I know pretty soon, we have had some online programs for that, and I'm in the process of switching some things up, making it more easier for patients to be able to follow. So, they can stay tuned to that and just get the free ebook that we do have available. And that's really a good start. We do have information on our website. So, we're continuously uploading that. And of course, with videos that we have from YouTube and so forth. So yeah, this is my, I always say, I love this part. I love the hormones. I love gut health. I love thyroid, anything that has to do with, just taking care of your body, taking care of your health, because when you feel good, you're actually, I always tell people, when you take care of you, you're taking responsibility for you, but in essence, you're changing the world with that too. It's harder for you to be mean to people when you're in such a good mood and life's great and you feel amazing. It's just like you want everybody to feel like that, right? But when you're not feeling good, it's just like everyone is like, everyone's doing everything wrong.
Yeah, it affects your entire life. Definitely.
Yeah.
That's awesome that you have that book, those resources, www.drlindamarquez.com, for anybody, right?
Yes, they can go on there, and we give some guidelines there.
Awesome. Anything else before we go?
No, I think we covered a lot. I was just, you covered a lot as well. Just the importance, like we talked about the liver, the gut, and a lot of it just comes down to, what are we putting? And we keep just emphasizing. I know we sound like a broken record, but it's really about, what are you putting in your body? What are you putting in your body? What are you putting in your mouth? That's so important. Food is everything. Food is the most powerful. They say it could be the most powerful medicine or drug out there, because, Twinkies are considered food, but that's not. That could be a drug with all the sugar in there. But it really is a powerful medicine, with the genetic, the way your DNA is going to be expressed because of what you're eating. So, yeah.
That's awesome. All right. With that, we're going to finish the podcast. I hope you guys found it so interesting and amazingly informative, like I did. I was taking notes and I learned so much. I think I'm going to have to listen to it like 3 more times. All right. Thank you, everybody.
All right. We'll see you. See you next week. Bye.
Bye.